You know you are safe. You're sitting in your living room, the doors are locked, and there is no threat anywhere near you. But your heart is pounding in your chest, your breathing is shallow, and your muscles are braced for impact. Your body is reacting to a danger that your logical mind knows isn't there. When treating this kind of physical distress, the default tool is usually traditional talk therapy. Psychologists refer to this as a top-down approach. The idea is that you use your neocortex, the conscious, thinking part of your brain, to analyze your feelings, generate logical insight, and eventually convince your body to calm down. You think your way out of the panic. But when you are experiencing a severe, sudden spike in physiological arousal, logic is remarkably weak. Telling yourself to calm down rarely lowers a racing heart rate or relaxes clenched muscles. Rational thought is insufficient to stop the panic because the trauma driving it operates entirely beneath the level of conscious reasoning. This illustrates the window of tolerance, a model tracking optimal nervous system arousal. Inside, you handle the ebbs and flows of daily stress and think clearly. Unresolved trauma damages this system. The boundaries pull inward, forcing your stress capacity into a much narrower band. A minor stressor can now easily push the nervous system completely outside the window. Spiking above it triggers hyperarousal, a state of panic, fight, or flight. Dropping below it causes hypoarousal, where the body freezes, goes numb, or shuts down entirely. Once your body crosses outside this window of tolerance, the biological mechanisms required for rational thought are taken offline. Your logical mind completely loses its ability to self-regulate. The human brain processes information in 3 tiers: cognitive, emotional, and survival. The bottom survival tier constantly scans for threats. When perceiving severe danger, it executes bottom-up hijacking. It seizes total control of the nervous system and actively shuts down higher cognitive functions. This excerpt from clinical literature defines exactly how bottom-up hijacking operates. It notes that the sheer intensity of trauma-related sensory motor reactions disorganizes cognitive capacities, completely interfering with the brain's ability to regulate itself from the top down. This hijack triggers a physical cascade. The heart races to pump blood, adrenaline floods the bloodstream, and muscles tense for an attack. The higher brain then feels this extreme physical arousal and assumes there must be a valid reason for it. It misinterprets the rapid heartbeat and tension as proof of an immediate threat, ignoring the reality of the safe room you are sitting in. During a trigger, the survival brain overrides the cognitive centers to force a primitive survival reaction. Because the body is driving the response, many clinicians now use a reverse approach called somatic therapy or sensory-motor psychotherapy. This is a bottom-up counterpart to traditional counseling. Instead of talking through past memories or trying to reframe negative thoughts, this method temporarily bypasses the verbal narrative. It focuses almost exclusively on tracking the physical sensations happening in the body right now. The clinical objective is to find the thwarted survival responses, like the urge to run or fight, that were initiated during the traumatic event but were frozen before completion, leaving them trapped in the nervous system. By noticing these sensations, patients can safely discharge that pent-up energy. Effective trauma resolution requires interventions that engage the nervous system's instinctive patterns correctly. We can see how this works in a specific clinical example. A therapist observed a trauma survivor who unconsciously maintained a perpetual deep slump in his spine during sessions. The physical collapse of his chest and shoulders was actively sustaining his psychological feelings of passivity, helplessness, and inferiority. His body was continuously signaling to his brain that he was defeated. This clinical text details somatic methods for assessing and shifting these holding patterns. Rather than arguing with the patient's thoughts, the therapist had him mindfully correct his posture and breathing. Modifying a physical defense mechanism directly sends biological safety signals back up to the cognitive brain. Straightening the spine physically altered the patient's psychological reality, making his thoughts less negative and his emotions more buoyant. Bottom-up somatic work provides the physiological foundation that allows top-down cognitive insights to become permanent. Clinicians refer to this integration as holistic processing. It is a fully realized two-way circuit where the mind's cognitive understanding and the body's physical regulation finally work together in sync. Since trauma is an injury of the nervous system, psychological recovery remains incomplete without the physiological restoration of the body.